Friends, good afternoon. So let us start our today's session of another YouTube live. Today, as a part of that summer remedies, which I could not complete owing to the questions on the previous webinar, I would like to discuss. We discuss remedies like antimcrude, lachesis, natrum mur, natrum carb, pulsatilla, belladonna. There are few remedies which you should know in relation to sun headache and aggravation from sun. The first remedy, that the second part of the first remedy is Brownie alba. Now, if you look basically to Brownie alba, it's a very interesting remedy. I know everybody has read Brownie alba, but the most important thing in Brownie alba is it is suited to persons, adapted to persons with gouty or rheumatic diathesis. Now this is a very important remedy because it's a very important remedy where the complaints come when warm weather sets in. Warm weather sets in after cold. No, from after cold to warm, then bryonia is indicated. Getting hot in summer, that is bryonia. And the characteristic symptom of bryonia that we all know, and that is aggravation from motion and better by rest, complete rest. This symptom will be very important symptom in prescribing bryonia in any condition, especially sun headaches or great thirst of large quantity of water at long intervals. Okay. Now, the headache of bryonia is also very peculiar. Headache when stooping. And the patient of bryonia feels that the brain will burst, especially the forehead, especially from ironing or coughing. So this is a very important symptom, or whenever he opens the eyes first, headache starts. So the patient comes and tells you that whenever I wake up from the bed in the morning, my headache starts. And this is a very important symptom of Brownie alba. So I welcome Dr. Kocher, Dr. Singh, Dr. Amit, Dr. Meera, Dr. Disha, Dr. Alam. Hello, Dr. Tony. So this is again a very important symptom of bryonia headache, because see, I told you headache of glonine, headache of natrum mur, headache of natrum carb, headache of amyl nitrosum, headache of belladonna, and headache of bryonia. The forehead would burst, and in the morning when he opens the eyes, there's a lot of bursting headache. That's a very important symptom of bryonia. And of course, in relation to sun, everything is there. The next symptom is there of bryonia. Elements from. Now this is again very important in bryonia, maybe some offshoot of that sun headache, from chagrin, mortification and anger. These three symptoms you have to write down in bryonia. These three symptoms are very important, that chagrin, mortification. This is one part of symptoms of aggravation from sun or exposure to sun, that is bryonia. Next remedy that you should remember, of course, one of the very important remedies, and I think I have told you symptoms of this remedy in detail. It is written that I am telling about Nux vomica. Nux vomica is successful with a person of an ardent character. Now this is written by Hahnemann. Ardent character, very irritable, impatient temperament and disposed to anger. It is written by Hahnemann in Allen's keynote. Very important, because you always remember Nux vomica as element from debauchery, thin irritable disposition, wants to do this, wants to do that, very much ambitious. But this symptom is a very important symptom of Nux vomica, that Nux vomica persons are ardent in character, irritable, impatient temperament and disposed to anger. And see, normally we find a Nux vomica as a go-getter, but a Nux vomica patient has inclination to commit suicide but is afraid to die. You will get in most of the cases Nux vomica where the patient comes and tells you that he'll commit suicide, he'll do like this, he'll do like that, but is afraid to die. This again is a very important symptom of Nux vomica. Of course, it has a lot of other symptoms of Nux vomica, but disposed to be quarrelsome, disposed to be malicious, disposed to be spiteful, disposed to be nervous. These again are some of the very interesting and important features of Nux vomica. Of course, elements from sun. Elements from sun means the patient is so oversensitive It can be at the sun, it can be light, it can be odor, it could be music. It is written, trifling elements are unbearable, even harmless word offend. And we normally think about chamomile or ignitia, but nux vomica is also a very, very important remedy in these conditions. So, elements of sun and sunstroke, bryonia, nux vomica, and one remedy which I would like to share today. Again, though it may seem that okay, this is quite common, but no, this is again a very, very important remedy, and that is opium. Opium has a very, very interesting symptom, elements from sun or elements from sunstroke, and the patient can have all the symptoms, especially now what? Of course, it is written that opium is indicated especially in children and old people, or the disease of the first and second childhood, very close to Brattacar. And the hallmark symptom of opium, want of susceptibility to the remedies and lack of reaction. This becomes a very, very important symptom of opium. This is a very, very want of susceptibility to remedies. And how is the sleep? That is also sleepy but cannot sleep. If some patient comes and tells you sleepy but cannot sleep, don't always think of opium, because there are two other remedies, chamomilla and belladonna. These also remedies are very, very important when the patient is sleepy. Patient says, "Mujhe bahut neend aa rahi hai." She goes to sleep and there is no sleep and she cannot sleep. So these are the symptoms of opium in relation to sun. Of course, it is there, sunstroke, sun elements, and all complaints. If you have read Allen's keynote, all complaints with great sopor, painlessness, of complaints which are painful or wants nothing, that is a very important symptom again of opium. So 5 common remedies and 4 uncommon remedies that you should remember in case of sun or sunburn or remedy from sun. Of course, do remember gluonine, amyl nitrate, pulsatilla, natrum, natrum ka, belladonna, ammonium ka, black acid, the frequently prescribed, and then opium, nux vomica, sometimes rarely prescribed, and also do remember strontium carb. Strontium carb is a very, very important remedy. As I always tell you, if you get 3 marking peculiar symptom of a remedy, that strontium carb is better by sun. This is again a very, very important symptom of strontium carb. Sun, exposure to sun, elements from sun, the complaints ameliorates. Imagine a patient coming and tell you that when I sit in the sun, I feel happy, I feel absolutely fine, the whole skin becomes black because of the heat, but the patient says that I am better. Recently, I showed this case in one of the seminars where when I was speaking in the seminar and told that a strontium carb patient is better by sun, is better by sun. He's so happy with the sun that he sits in the sun the whole day. He becomes totally tan, but he feels happy. So people could not appreciate whether the patient is there or not, this type of patient. But then I showed the video and the patient said exactly this symptom, and people were surprised that this symptom also is present in some remedy, and he was prescribed strontium carb. It was a case of renal failure. The creatinine came to normal and the patient was absolutely healthy with a single dose of strontium carb. So if you know aggravation by sun, you must know amelioration by sun also. Do remember strontium carb. Okay. So good afternoon, Dr. Weber. Hello, Dr. Avni, Dr. Venugopal. So one question is, if we identify psychotic miasm in patient, then what centrifugal potency one should give to start the treatment? So it is not a law basically. If you feel that the psychotic miasm is there and you have matched the miasm and it is matching the miasm, matching the symptoms, matching the simillimum is matching, then you have to start. Normally I start with 30 potency and then gradually go forward, because if you see in Hahnemann's time, we only had 30 potency. So you have to start in psychotic case with 30 potency. So as you go further, if we have some time, I'll definitely have some this on the potencies also. But today let us do something about sun. So these are the basic remedies. And now, sometimes what happens, that because of the sun, because of the heat, there is lot of congestion in the base of the brain. The patient comes and tells you, Doctor Saab, I have severe pain here in the base of the brain. Severe pain, there is violent palpitation, and there is dilatation of pupils and cold and clammy perspiration, sudden collapse feeling. The pulse gradually slows down, and it's a very, very important remedy, that is Veratrum viridi. Veratrum viridi is such a fantastic remedy, when the patient comes and tells you aggravation from sun, he has went in the sun with severe headache, especially the base of the brain, with jerks, with palpitation, with cold kind perspiration, the pulse are low, then you have to think about Veratrum viridi. I'm not talking Veratrum alb, but Veratrum viridi, and it's a very, very important remedy in these type of complaints. Especially, it is a remedy for full-blooded plethoric persons. If you have seen Matermedica, it is written remedy for full-blooded plethoric persons, congestion, especially to the base of the brain. Such a interesting remedy, such a fantastic remedy. Do use this remedy if you get this type of symptom. It is written in a Matermedica, nervous or sick headache, congestion from suppressed menses. This is important. Congestion from suppressed menses, and the patient has violent nausea and vomiting. Normally, when we get nausea, vomiting, we think about ipecac or some other gastric remedies, but if we forget Veratrum viridi. So, study Veratrum viridi, and it's a very, very interesting remedy for sun and sun headaches. Thymol for potency means 200 potency means 4 pills. I normally give 4 pills, or if I have to give in water, I give 2 drops of the medicine in 1 spoon water taken in the mouth. Varicose vein around the neck in the rectum. No, varicose vein around the neck. I have not got a case of varicose vein of the neck, but in the rectum I do have. But see, the basic pathology of varicose vein, you have to understand that what happens in varicose vein, there is inflammation of the veins. Okay, and wherever if you see inflammation, so some remedies are very, very common, especially if you get varicose vein in the perineum, perineum. Okay, just below the rectum, in the perineum. Now this is it's almost a specific remedy which I have seen in my practice, and that is allosocretina, especially varicose or varicose in the perineum is allosocretina. And of course the symptoms are same, that there is extreme prostration, there is perspiration, and there is a bunch of veins, especially reddish, there are throbbing, surging of blood, and like we have that piles are like a bunch of grape. In the same time, there are lot of veins which are very itching, heat, painful, and the patient is difficult in sitting. It pricks when the patient sits. That is also cretina. But frankly speaking, if you are treating a case of varicose vein, we have remedies which are very, very common, and that has to be used and thought of first. For example, varicose vein, the most important remedies you have to remember first is arnica or havamelis or fluoric acid or calcareca. These are very, very important. And then as I always tell you, you have to define that varicose vein. For example, there is the patient comes and tells you, the normal ladies, they show you around the calf, around the thighs, around the knees. There is a network around the in skin. So there is network of veins. Then you have to think about remedies like Crotalus orodis or causticum or lachesis or carbovage. These are remedies. Sometimes the patient comes to the varicose vein are very painful. That it can be anywhere in the body, in the rectum also, in the hip, in the lower extremities. It is painful. So whenever it is painful, think about pulsatilla, hemamelis, millefolium, bromium, and then see the type of pain. There is shooting pain, there is soreness, there is stinging pain, there is stitching pain, different type of pain. But whatever I have seen in my practice, there are cases where you get varicose vein, especially during pregnancy. And whenever if you get varicose vein during pregnancy, it is very, very important to treat that in that time only, because if it stays, then what happens, that automatically it stays for life, and then the veins are there and there's a lot of torsity, ulceration. So varicose vein during pregnancy, if you get a case, think about 4 or 5 remedies which are very, very common. Lachesis, ferrum metallicum, pulsatilla, Naxomica, Millifolium, Lycopodium, and do go home and read the Mater Medica of these remedies, because if you understand the Mater Medica, of these remedies, then you automatically have that inclination to treat that case. For example, if you see lacuses, it is written beautifully that purpuric septic states, and the veins are bluish in color. There is lot of itching, and so there are different type of colors also. Then if you have seen this type of veins, automatically you get to know that what to prescribe. Like there is a blue and black swellings. The blisters are very dark. It is indicated where the boils are there, carbuncles are there, surrounded by bluish surroundings. So these type of things are very, very important in a remedy. So it is not only varicose vein that we see only the reddish part, but we see the network of veins, the color of the veins, the inflammation around the veins, and then try to prescribe the remedy. So always, if you see varicose vein, general prescription is Hahnemann and Millifolium and all. But it is important to understand and define that pathology of the, as I told you, type of pain, the soreness, the stitching pain, the pregnancy. There are a lot of other things to see in varicose vein. And the physiology basically every time is same, no? So torsity is there and all. So wherever it is, symptom is important. I had a case where he had varicose vein in the whole length of the leg, and the veins used to break very easily. He touched and it breaks. And I only prescribed medicines like phosphorus. I prescribed phosphorus, then I prescribed calciferous, and like I said, it failed. But when I read Mater Medica, and there was a wonderful remedy, yarrow, that is Millifolium, where it is written in the Mater Medica, the varicose veins plethoric breaks easily. And Millifolium was given, and automatically the patient became normal. So it is important to understand the type of vein first, that is important, and how the vein is affected, the color of the vein, so you'll be able to prescribe better. That is how you have to see in cases of varicose vein. Of course, those are difficult cases to treat, but definitely you have to understand and have to prescribe. Right? It is written in Millifolium. It causes soreness, congestion, bruises, and breaks easily. That is Millifolium. So that's how you have to go and prescribe in case of varicose vein. Please dropsy after suppressed sweats. Now, see, if you are treating a case of dropsy, it is not that the patient has been treated because of dropsy and of sweat or other excretions, like we have an apocynon, that excretions are suppressed like the sweat and perspiration, he gets dropsy. It is not a sudden process. First you have to understand in case taking that why the patient is suffering from this type of symptom. Like for example, edema. The patient does not develop edema instantly, like you have treated a case of increased perspiration or suppression, suddenly you get edema. It's not like that. So gradually the patient starts complaining of single part edema, single part dropsy, and gradually when it increases day by day, the patient develops that dropsy or edema. So it is basically a process where you have to understand that it has and then in case taking you come to know, okay, we find the origin of the disease. That is important, and in those cases then you can prescribe remedies. There are lots of remedies, like you have apocynon, you have other remedies where there is suppression of natural discharges and the patient gets symptoms. So it's a process, it's not immediate. Whatever experience I have in treating those cases of dropsies, of course, in cases where the urine is suppressed totally, the patient has been given some medicine and the urine is suppressed and the patient cannot pass urine. In this case, dropsy could be very instantly, because some elimination has been stopped and suddenly the patient gets dropsy. In this case, it can be sudden, and we have remedies like Dietalis, we have apocynon, we have Ilserum, we have Adonis vernalis. Like in Adonis vernalis, we have dropsy after influenza or bright disease. Now this is fast moving. Okay, this is in suppression of sweating. I have seen it is basically gradually slow process. Yes, other questions? Post nasal drip with a discharge, white of egg, right of nose is more or less homeopathic remedy. Yeah, so in discharge, basically, discharge, what could I tell? I first of all would like to tell you that don't treat this type of acute complaints, discharge like the white of an egg. It is solely complaints, so why do we want to treat those complaints? But still, if you feel that you can take a simple rubric like what we call blend discharge. Like euphrasia we have, like pulsatilla we have, like sepia we have, like cilicia we have. The discharge are blend, and then gradually if the patient can describe it very properly, like the white of the neck, it is same as that blend discharge and whitish in color. So take that type of rubric, or you can say discharge is albuminous, that is very close to the white of a neck. That you have to think about Kalimur. Now Kalimur basically is a very very interesting remedy, because hardly Kalimur is given. I have seen in my practice, because in Kalimur other symptoms are so, but albuminous discharge, like the white of an egg, you say, it matches very very closely to Kalimur. And if you have read Kalimur, it has a very very important and a very very interesting symptom. That is, if you open your Matermedica, if you have Matermedica, if you read Kalimur, it covers so many symptoms of nose that I think fits in most of the cases. For example, in Kalimur it is written catarrh and the phlegm is white and thick, thick phlegm, and the nose is stuffed and cold. And it is said that the vault of the pharynx is covered and with there is adherent crust. Very simple case, and very important, because in normal cases of cough and cold, we get this type of symptom. And in the same, if you see the symptoms of Kalimur, in cases of head symptoms also, the patient has same thing, headache with vomiting. So headache with vomiting, stuffed up nose, discharge white, very thick, albuminous, is Kalimur. So this is basically Kalimur. Of course, then you can say albumin discharge. Of course, natrum, don't forget natrum, don't forget natrum sulf, and also don't forget iodum. Iodum normally is never thought of in this complaints of discharge, which is albuminous and all, but iodum is a very very interesting remedy. If you have read iodum, it has, see, iodum, if you want to prescribe, no, there is one symptom of iodum, this is very important: sudden and violent sneezing. Suddenly the patient comes to you, doctor, in the morning I was okay, but suddenly in the afternoon I have started sneezing so much, and the sneezing is so big and is so violent that everybody has told me just go and show the doctor first. Sudden and violent sneezing is iodum. Nose stopped up also is iodum, and tendency to ulceration is also iodum. These three symptoms are very very important symptom of iodum. I hope Dr. Izarvit, you got some symptoms of the discharge, so you can relate those white of an egg to albuminous discharge or thick and blend discharge. Can osteoarthritis be reversed in homeopathy? First of all, basically I have to first say that whether I have cured osteoarthritis in homeopathy. Yes, I have had cases where osteoarthritis was reversed, but I would definitely say not all cases. I have definitely failures. I have patients who have recovered and who have, I have failures where the patient only temporary is better. I have cases where the patient is much better. He can move about, he can live his normal life, but still some pain is there. So 80% is better and 20% the problem is there, but because that's a degeneration. And few cases of arthritis of knee also I have cured, where there was no problem and the patient is absolutely healthy. The patient can run, patient can dance, there is no problem. So very wide results, sometimes no results, sometimes good results, and sometimes very good results. And very good results basically we measure with Herring's law of cure. So whenever you're prescribing a case of osteoarthritis knee and the patient gets symptoms of Herring's law of cure after the application of your anti-miasmatic remedy, then you can say it's a cure. Of course, osteoarthritis is definitely a disease where it takes normally a good case taking, a good repetization, and a good prescription. And you have to understand when to wait and when to prescribe. That's important. 50 years of female that her husband and daughter do not love her. She prepares a nice meal and husband and daughter say that the meal is not good and she feels sad. First of all, just by husband and son telling the meal is not good, and she makes her own thinking that they did not love me, so I would not prescribe basically on a single symptom. If the lady feels that the husband or the child does not love him, it has to be more in relation to the heart and related to the expression, not related to the material world. So first of all, basically try to analyze whether the patient is feeling that way or actually that is the cause. So that's why Hahnemann has told us the case taking has to be done with the patient and the associates and the attendants. So we try to get exact case. For example, I'd like to share something. Whenever we start taking a case here in our place, most of the daughter-in-law will tell you, my mother-in-law is not good. She does not give me proper to eat. She makes me do all the work, and I have a lot of fear with my mother-in-law. And most of the time, we find that, oh, poor daughter-in-law, and we take the rubric elements from dominance, elements from abuse, and we land up in few remedies. But as you mature in practice, and after 10-20 years, you find, oh God, every second daughter-in-law is completing the same thing. Then you have to first analyze actually the situation is that, or the patient is feeling that way. So it is important to first define your symptom, that whether this symptom has to be taken for prescription, or it is just a symptom, it's a normal symptom, and the patient is so sensitive about trifles, and she thinks that the trifles are important, that just by not eating the food she feels that they don't love. So that is important to analyze the case first before going into for the prescription. I hope you understood that. Yeah. So can we go forward? Or we have some other questions? I think some questions have scrolled up, so you can keep asking. Yeah, what I was telling, I want to tell you something about element of sun also. I had yeah, I hope. Yeah. So case taking, and for me, if you ask, everybody asks me, sir, your mathematics is good, your repertoire is good, your understanding is good, your knowledge is good. I always tell, understanding mathematica, organon, repertoires may be easy, but your basically cure, a good prescription and a bad prescription only depends upon the art of interpretation. If you are able to interpret a patient's symptom in a repertory language, or you're able to interpret the whole summary of the case very precisely, and you have landed up to a similar after a perfect interpretation, nobody can basically take a cure away from you. Your art of interpretation is a thing which will decide whether the results will come or not. You have ample knowledge of mathematica, you have ample knowledge of themes of the remedy, you have ample knowledge of the repertory or rubrics, different repertories. But if your interpretation of a case is not good, then whatever you put in the computer for repertorization, only that will come out. Your interpretation is very important. I hope you understand that, everybody. Okay, please answer my question. So yeah, so can you write down the question? 1 second, Dr. Yasin. I think I've scrolled up. One more time. Yes. Non-stop vomiting of undigested food since the what? Since the means? See, whenever if the patient is coming, just complaining that there is vomiting, and you feel that you are not getting the prescription, so after eating. So when the patient complains that 1 month whatever he eats vomits after 10 to 20 minutes, okay, vomiting after eating, you want to say, is it that? Vomiting after eating. Make sure that the symptoms when you ask to a patient is basically what to call, I would say, see, because vomiting after eating, there are so many remedies, and if you ask me, I can start from A and L till Z. But first of all, you have to understand why the patient is vomiting after food. I'll tell you the remedies first. Whenever if you have cases where the patient says that vomiting after eating, think about China Rs. I'll not tell you arsenic first because I have got good results with China Rs. China's first, arsenic second, third ipecac, phosphorus, veratrum. These are the very, very important remedies when the patient says that after eating, I get vomiting. These are the very, very common remedies which I have seen in my practice. Do write down some very, very rare remedies which I have used and have got very, very good results. That is zincum phos and zincum metallicum. Rare remedies, but I have got a very, very good result with this case. And write down one remedy again that is very, very rare, and the remedy which I am talking about is tabacum. Tabacum is a very, very important remedy in vomiting after eating. And the vomiting of tabacum, if you have read tabacum, It's such a nice and such an interesting remedy. It's written the vomiting is so violent, there is whole cold sweats. That is tobacco. And there is a very faint feeling and sinking feeling in the pit of the stomach. And the patient feels there's relaxation, there's continuous nausea like ipecac. And then the patient suddenly has diarrhea, yellowish green in color, with nausea, vomiting, prostration and cold sweat. पूरा पेशेंट ठंडा पड़ जाता है उल्टी करते करते with faintness. And then you have tobacco. I don't know whether you have used this remedy tobacco, but it's a very, very interesting remedy in cases of vomiting. Yeah, vomiting. You can see. Then once you have once you have seen the case that see once basically if there's something which is not getting digested, and the patient and the body feels that he has to throw it up, so the patient will feel that he is better by vomiting. So in this case also, if vomiting ameliorates, you'll be surprised that if vomiting ameliorates, you have to think about tobacco. You have to think about digitalis. You have to think about, I think, sanguinary canadensis is also there. And you have to think about Eupitorium perfolatum. Vomiting ameliorates. But see, if you repetize the symptoms in the repertory, and if you put two symptoms, that vomiting after eating and vomiting ameliorates. In this case, whatever repetirization I can do mechanically, the remedies that come to the repertory chart would be arsenic, I think carbon sulf, pulsatilla, tobacco, and digitalis also will come. That is vomiting after eating food and vomiting ameliorates. So these 5 remedies, whatever repertory knowledge I have, little bit, I can repetize these 2 symptoms. The 5 remedies very important: arsenic album, carbon sulf, pulsatilla, tobacco, and digitalis. So you try one of these remedies and it should get good results. Persistent nausea, yeah. So these are the remedies that you should think about. I hope you crack this case, and next time we hear from you that the case has been solved and the remedy has worked. So, okay, if you have case where the patient complains one thing, that is continuous nausea. Now, again, in this case, I would say that do define the symptoms properly. You have to identify that these symptoms have to be, because there are a lot of remedies where it is written that there is constant nausea. Again, now constant nausea, we have remedies like Antimtad, Nux vomica, Ipecac, Cilicia, Creosote. These are remedies which basically have constant nausea. And now again, if you repetize these 3 symptoms, that aggravation from eating, constant nausea, and vomiting ameliorates, now your remedy chart will be slow. That is, will be more precise. Arsenic album will come, Antimtat will come, Nux vomica will come, and digitalis will come. 4 remedies will come. See, this is how you have to repetize. So these 4 remedies: Antimtat, Nux vomica, arsenic, digitalis. One of the 4 remedies should be able to heal your complaints. I hope, Dr. Yasin, I'm able to give some entry point of the case, and I have repetized mechanically whatever knowledge of repertory I have, and I hope you repetize again these 3 symptoms and get back to me. My experience of arthritis nosode. No, yeah, I have the remedy arthritis nosode. I always keep thinking to use that nosode, but with the normal case taking and the normal polygus remedies, I have got good results. So I have not used this arthritis nosode. Only, I think in my practice, I have used only twice this nosode, and it has given me fairly good results in case of arthritis. Persistent nausea, thanks. Good afternoon, Dr. Navjot. So can we move further? Yeah, so this is good. I was basically thinking about to complete the sun remedies, because there were a lot of questions regarding to sun, but okay, we'll take more questions. Any questions more? Icterus in newborn 4 days, day 3 to early born baby drinks but don't have motion. Icterus in newborn, 3 weeks, 4th day. 4 days, 3 weeks. 3 weeks, 4 days, too early born. So premature, don't have motions. The question, Dr. Bawal, is it icterus in newborn, day 4 day, 3 weeks to early born? Okay, so premature, drinks but don't have motions. Now, if you have these type of complaints, like for icterus in newborn, yeah. So in this cases, if you basically have seen that the patient is having constipation, especially in newborns, no, whenever there is constipation in newborns, one or two remedies that with icterus, of course, then one or two remedies are very very important. First is Naxomica, second is opium, and third I have got very good results with Zincum metallicum, and fourth with sulfur. So these 3-4 remedies are very very important, whether it is icterus and constipation in newborn: Naxomica, opium, Zincum metallicum, and sulfur. Yeah, both babies 4 days. So you can take a simple rubric: constipation in newborns and icterus. So these 4 remedies should come in your repertory chart. I hope whatever answers I have given you, you try in your practice, and whatever it is, if it is good, tell me. If it is not good and it is not happening, then we can always think of something more, and take a better case. So it's important that you have a follow up properly. Swelling of right knee joint by sitting on ground. They are cricks in joints, painful. Ruta hypericum fails. How to proceed? Now, see, the most important thing is swelling. So basically, we have case where it is a psychotic miasm. And when you are treating a case of swelling and pain, so it is very important that the swelling goes, the psychosis goes, and then the sora goes. So whatever remedies you're thinking about, now if you've already told me that it is hypericum, ruta, fail. I don't know why did you use ruta or hypericum, but whenever there is swelling of joints, it is painful. There are few remedies which, and I think there is cracking in joint. What you mean to say? You have to use remedies which are very, very. Your question is very related to a remedy which are swelling, painful. So you have to think remedies like Actia spicata, bryonia, benzoic acid, ledampal, sulfur. And then I will always say whether the swelling bluish, whether it is dark, whether it is odematous, whether it is shining. So this is basically the which you have to see and prescribe. So these are the remedies. A simple remedy, what I would say, is Actia spicata, colchicum, bryonia, ledampal, sulfur. Main remedies, of course, there are so many remedies. You have rhododendrons, you have rustox, you have natramure, you have kali chlor, a rare remedy, important, lycopodium pulsate, a lot of remedies. Male 68, legs, muscles, weak, back pain. 68 years patient, the leg muscles are weak, there is backache. So if you have, just starting with heart swelling, so the remedy, these are the remedies also. So whenever if your case that the patient is 68 to 70 years of age and he has this swelling, especially in the morning he gets up, there's a lot of stiffness. So there are few remedies which are very useful. Allen's keynote, if you have seen Aesculus hypocasterum, is a very very interesting remedy and a very very good remedy in this condition, old age with muscle problem. Second, you have to think of remedies like Agaricus muscarius, Calicab, Rustrox, Trichinum fos, and there is one remedy again which is very very important, that is Silician thuja. So these are the remedies which I use normally in practice. Very very acute remedies like Formica rufa is there, Guaicum is there, Stilingena is there, Inadadana is there. These are very very rare remedies. First part out, I told you the common remedies. Heart swelling also, the remedies you can add causticum to that. You can add causticum, and there's one more remedy which is again important with swelling, and that is kali iode. Sir, where we can use medorinum? If you have read medorinum, it's a, such a it's a remedy where Hahnemann also writes that medorinum has to be used not only as a nosode but as a remedy normally also. So don't always think when to use a remedy. It is basically depends upon your case taking, and actually the remedy has come in your repertory chart. Don't always just think somebody has told you that start a case with a nosode and nosode will open up the case. It's not always there. It may be written in books, but I have not experienced that. So whenever if you're using medorinum, there are some symptoms of medorinum that are very, very common, and you have to understand and read that medorinum. For example, anybody can tell medorinum symptoms? Very, very common, very, very interesting symptoms, and very, very classical symptoms of medorinum. Anybody? Elements from, who can write? Elements from suppressed gonorrhea. That's medorinum, Or you can say lying on the abdomen ameliorates, fresh hair or hard rubbing ameliorates. That is medorinum. Or you can say in medorinum, time passes very slowly. Discharge inevitable. Yes, Dr. Kadir, you are right. Constant fear as if somebody is following her. Cannot speak without weeping. That is also excess in everything. Yes, psychosis, miasm. So you're basically trying to tell me the psychotic miasm. But symptoms of medorinum, I'm telling you, chronicity of complaints. In medorinum, one symptom will suffice the whole Matermedica. Chronicity of complaints. Discharges, profuse, acrid. It causes itching. The offensiveness of discharge. It is written in a Matermedica. Fishy odor. The body smells sour. And the enlargement of the lymph nodes. This is medorinum. Time passes slowly. And a medorinum, remember, has craving for salt, sour things and oranges. And a very, very interesting symptoms of medorinum. Some patient comes and tells you that he has recurrent बार बार उसको urethritis होता है. This is a very, very important indication of medorinum, my dear friends. Non-specific urethritis. Non-specific urethritis is a very, very important symptoms of medorinum. If you have read Allen's keynote first line, whatever I understand, that is for the constitutional effects of maltreated or suppressed gonorrhea, when the best selected remedy fails to cure or fails to relieve or permanently improve, that is medorinum. Okay. Craving for, I'll just finish medorinum and come to pani puri, because when it is pani puri, everybody gets that type of craving. In medorinum, there are two sections written in our Matermedica Allen's keynote for persons suffering from gout, rheumatism, and disease of the spinal cord, which has origin which can be traced to the psychotic origin, or woman with chronic ovaritis, salpingitis, pelvic cellulitis, fibroids, cysts, same way with or without psychotic origin. That's why it is said that it is used for scaras or carcinoma or cancer in ladies where psychotic history can be traced. That is the importance of medorinum. So it is, I would say, don't try to fit medorinum. When the patient is medorinum, automatically medorinum will come out from your pen also. Okay. Craving for pani puri. First of all, tell me how many persons, how many doctors, how many laymen have told you that they don't like pani puri? How many persons have you come across in case taking? They have told you that they do not like pani puri. Anybody? Anybody? Very, very easy question. I want to tell you very, very plainly. I don't know what other doctors do, but basically, if I'm teaching you, taking this YouTube, I want to make you understand there are some symptoms very so common in the practice, but then we try to glorify this symptom and then put some themes on it and then prescribe the remedies. Okay, anybody? No one. And most of the patients will come and tell you that they love pani puri. In fact, by describing pani puri also, you want to eat pani puri, at least one or two pani puris. So it is, I have seen in so many cases, people love eating pani puri, and then we say, oh, patient likes some chatpata food, so it could be pulsatilla. Don't prescribe on those symptoms. Those are very common. Yeah, especially ladies. Okay. Gents also, we also love pani puri. But I'm just trying to be very frank and transparent with you that I have seen lot of persons and the asking pani puri person that, हाँ तो चलो चटपटा पसंद है पल्सेटला पेशेंट हो गया या other remedies. But these are very common likings, so if you try to prescribe with these symptoms, you land up in a very acute superficial remedy which will not go to the depth of the remedy. Yeah, so there are other remedies also. I'm not telling you the remedy, I'm just trying to explain and being transparent that first of all, when we started our practice, we used to ask these type of questions. Pani puri pasand hai kya? Do you like ice creams? Do you like curd? Do you like buttermilk? Or do you like to go out? When you're weeping, you like some consolations? And most of the time, the answer is yes, 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 yes. And immediately we have remedies like pulsatilla, like antim-crude, like causticum, like these remedies which has everything. But then we fail. Yes, most of the see this such a fantastic answer. Such a, yeah, lemons also. It is such a common symptom, but don't try to glorify those symptoms which are very, very common, like diseased lemons. So then we have remedies like belladonna and ammonium. I think belladonna we have ammonium urea, we have sabardella, nitric acid, and you prescribe and you fail. So some common symptoms you make a list that some ladies have fear of lizards, fear of cockroach, and cannot go in the lift. They feel claustrophobic. So these are very common symptoms, So don't try to glorify. And these symptoms, if you want to take, you can take that for prescriptions. But ultimately, go to the depth of the case taking so that you will be able to prescribe and become better prescribers rather than just prescribing on those acute craving which are very common. So there are few doctors who are out of India. I would like to tell them pani puri means, we say, spicy, which contains lot of spice, lot of lemon tinge, lot of salty tinge, lot of rock salt tinge. It's an Indian delicacy and it's really beautiful. Whenever you come to India, do it pani puri. Very good questions, and it makes the environment also very light. By discussing this. So let us go further. Any other question? So I think everybody is enjoying mentally that they're eating pani puri. You come out of that, it's already 3:50, so we have 5 minutes to go. I can answer a few questions. Sleeps on abdomen. Yeah, so this yeah, medorinum, no? Yes, medorinum is a very, very interesting remedy, and whenever first the patient comes and tells you that I sleep on the abdomen, the first remedy that should come in your mind is medorinum. But always don't give the remedy. Always ask some more symptom to get to medorinum, because when you prescribe medorinum a single dose, then you have to wait for months because it's a very chronic remedy. It requires time, so you have to wait. For example, sleeps on the abdomen. Apart from medorinum also, we have some remedies like carcinosin sleeps on the abdomen, like sulfur sleeps on the abdomen, calcarea phos, lycopodium, belladonna, pulsatilla. These remedy also have this symptom like sleeps on the abdomen. So while considering medorinum, also consider these remedies. Yeah, carcinosin is there. Acetic acid might be there in the repertory, but I have never prescribed acetic acid for these complaints. Whatever acetic acid I have known in my practice is, I have seen in case of acetic acid, it's vinegar basically. And I always remember that Alan Skinner first line, adapted to pale person with laxy, flabby, face pale and waxy. The first symptom and the most important symptom which I have read about acetic acid is there's intense thirst, there's burning thirst in dropsy, in diabetes, but no thirst during fever. Carbolic acid, yeah. So there are a lot of remedies where you can get, but whatever remedies I have used in my practice, I'm telling you. Here basically I'm just trying to share my clinical experience of any symptom that comes to my you ask me. So it is not only mater medica. Okay, so then you must think about medorinum, calcarea phos, carcinosin, nitric acid, belladonna, sulfur, which I have used very pulsatility, which I have used very commonly, and I have got good results. Acetic acid I have not used when a patient comes to me with sleeping on the abdomen. I have told you few symptoms of acetic acid which I have used in my practice. Carbolic acid, you have to remember one symptom: whenever the patient is working too much, exerting too much, he starts getting boils and pimples and abscesses. That's important symptom of carbolic acid. Dr. Kadri says, sir, kindly suggest book on miasm. Whenever you ask me something about related to books, my answer, you might feel that I'm answering everything every time the same things, but basic answer what I would like to give you: B.K. Sarkar, The Organon of Medicine, Hahnemann's Chronic Diseases. These are more than enough for you to understand the importance of miasm. And if you have read Chronic Diseases, the psoric miasm has lots and pages and pages. Psychosis, the page is very less, and syphilis than one page, because everything starts from the hydra-headed sora. It's hydra-headed. You cut one head of the hydra, and everything comes back. So see, don't study miasm. Study miasm while taking the case. Whenever the patient comes and tells you, I have headache, I have migraine, and you ask how is the pain, and say the pain is so severe. The pain is so severe that I have to go and hit on the wall. I have to pull my hairs. I have to tell somebody to walk on my head. Severe. I become insane. I don't know what to do, what to speak. I speak rubbish. I am in anger. Syphilitic miasm. Then psychotic. Then sora. So whenever the patient comes, a migraine comes to you, then you have to differentiate that headache into which miasm. Sora, psychosis, syphilis. Same way, if the patient comes to simple of hair fall, the patient comes to you and sits in front of you, a 20-year-old child, and says, I have a lot of hair fall, and you see the hairs are totally white. So, syphilitic part. Ask the psychotic, ask the sora, and the remedy comes. So, in case taking, when you are seeing the patient, it is important at that time only to differentiate this and then miasmatic remedy, because most of the remedy are triasmiasmatic, from aconite to zincum. So all remedies covers all the three miasms. So it is similia similibus curantur. What is the patient, what is the constitution, or what is the body throwing in front of us, that you have to catch and give the symptoms and give the remedy. Can I have importance to dreams of relative, dress, or its uncommon? Dreams of relative. A very interesting question. A very interesting question. And now see, I had these questions were asked me in one of the seminars, and I answered it this way: if you are a very sensitive person, if you are a very family oriented person, see, understand, or if you are very attached to the family and your joint family, and the dreams of relative comes in your mind, that dream then can taken as normal. Don't give it importance. But you are not a family person, you are a nuclear, you want to stay alone, you don't care about the family, you only care about yourself, and then you have dreams of relatives and family members, then that dream becomes more important rather than for a family man. This is my explanation, and you see in your practice also. You see in your practice that you will come to know this separation of dreams, is so important, because some dreams are so common. And if you try to prescribe that, automatically a prescription goes wrong. So this is how you differentiate which dream to take at what time. I hope you understood something. I hope, Dr. Singh, it was a good question, and this is how you are. And of course, the dreams basically only prescribing of a dream would be difficult. Then add fewer symptoms like modalities, like temperament, like thermals, and then you can get out with a very good remedy. Yeah, dreams of falling, like dreams of falling alley, dreams of teeth falling, dreams of missing a bus, dreams of not finishing the exams. These are a very common dreams, soric dreams. So normally in my practice, maybe 25 years back, I used to give importance to that, but now it's a soric dream, so I don't take basically for prescription. But if your remedy is right, automatically it will match with your remedy. Okay. It's already 3:57. So last question, anybody, and then we'll have it. We'll close the question answers. Any other question? Anybody? Single question so that we can finish it off. No? Thank you so much. So yeah, so thank you everybody. Thank you for your time, and I hope you enjoyed it as much as I enjoyed talking to you. Thank you so much.